everyone has this annual, like health checks. Do you think women are doing the annual health checks enough?
Annual health checkups are something I totally recommend, especially after the age of 30, which includes hormones.
So metabolic health of a person, do you think that's very related to cardiac health?
Yes, it is. It's when you're constantly scrolling till 2 a.m., so your heart doesn't get time to recover.
So we do know that scrolling increases cortisol in general.
Information overload.
Oh,
I think that
yeah.
also adds on to stress.
So are you seeing a difference like from the time you started to now within like the age group that's coming to you?
Initially, when I started, if there was a 30-year-old, the entire hospital, like a 30-year-old got a heart attack.
Okay.
But now it's like another 30-year-old got a heart attack.
Okay.
Yeah.
20 and 30-year-olds are coming as
Yes.
well.
It's not just post-menopausal. Anybody who is having a very stressful lifestyle can...
You actually thought that you should start something by yourself to actually help
Yes.
them, right? And that is how parties therapy came about.
Yes. Most of the patients who are coming these days don't have any history of diabetes or hypertension or family history or smoking. And the only thing I could relate why could they possibly be having a heart attack was stress.
Is post-COVID, they have said that the number of heart attack cases have significantly gone up after.
Yes.
Hi, I'm Dr. Lakshmi Ajit Veerappan. I'm a family physician and a women's health advocate. I feel that women usually don't take their health very seriously and they go quite late for interventional treatment, right? So join me on my first episode of Regain Your Health with Dr. Lakshmi. Today I have with me Dr. Diana, who is a third generation doctor and an associate consultant in cardiology in HMS Hospital, Calicut. I'm so happy to have her here with me today because who better to talk about women's heart health than a young woman in cardiology herself? Welcome, Dr. Diana, to the podcast.
Thank you for having me. It's an honor to be a part of something beautiful that you're doing.
Okay, so we have a lot of myths surrounding heart attacks, especially in women. Like, what is the age group which usually comes, and do women actually come for heart attacks? Because the statistics say that 90% of heart attacks are suffered by men. Is that true? And what do you see in your practice?
I think as long as you have a heart, you have every chance of getting a heart attack. The reason why that is the common notion is because most, not all, but most of the research was done on symptoms men have and men presenting with heart attacks. The way women metabolize, present, or even the way they process drugs itself is very different from a man's biology. And women have every chance of getting a heart attack. In fact, it is the leading cause of death in women.
Okay, so what are the symptoms that women face, like that they're missing right now? Like, what should they know? Like, in men, we have shortness of breath, jaw pain, left shoulder pain. What should women know?
Men usually have chest pain on exertion. So if, for example, they're playing football or they're walking up a flight of stairs and they get chest pain or breathless and they come to see the doctor. But women, they usually have less strenuous jobs comparatively. And so they present very late and they don't always present with chest pain. They just have breathlessness while climbing stairs, fatigue, anything that is not usual. On your day-to-day activity, if you're feeling excessively tired, it needs attention. Jaw pain, neck pain is not thyroid. It can be a heart attack. Back pain cannot be hormones. It can be heart attack. Nothing is aging. And don't disregard everything as indigestion, aging.
Okay.
Test
So,
it.
like above the age of 50, I actually heard, right? Like above the age of 50, when a man comes with indigestion, they're like, please don't send him home, keep him in the hospital overnight because that can always be like a heart attack.
Yes.
Do you think women come to the hospital first of all, like if they have these issues, or they don't
No.
come itself?
No, they don't come itself. They come very, very late. They brush it off very easily, saying it's nothing. I ate this, I ate that. They usually think they know what they're going through and they brush off symptoms very easily. Men are not like that.
Okay, so like with our audience today, right? Like if we had to tell them, okay, like if you have shortness of breath, even like a little bit, like when you're walking upstairs, like Dr. Diana just said, right? Like if you're walking upstairs and even like doing the small regular, like, things, if you feel fatigue, like say when you're
Yes.
washing dishes, you're feeling like lots of fatigue for 3-4 days, like actually go to the doctor, right? Just don't
Yes.
brush it off.
Yes. Even if you're feeling just giddiness, it you people, not just women, but everybody thinks it's just low sugar, low BP, I haven't eaten all day. What if it's a heart attack and your heart is not getting enough blood?
Mm-hmm.
Check. What is wrong with checking? Don't brush off symptoms so easily.
Okay, so now everyone has this annual, like, like health checks. Do you think women are doing the annual health checks enough?
Some are doing it, not all. Most are not. I
Okay.
think when they are pregnant, they do get health checkups, and then they think everything is fine then on. And then,
Okay.
unless they're actually symptomatic and something is bothering them, they never really come to the doctor. Annual health checkups are something I totally recommend, especially after the age of 30, which
Mm-hmm.
includes hormones. It's not just your whole blood count, hemoglobin, and all these common things. Check your thyroid levels. It's okay if it's normal, but check.
Mm-hmm. Okay.
Do all the regular tests, but always add hormones, vitamin D, and extra tests for women.
Okay. So the hormones and vitamin D, all of that is important as well in the annual check, not just
Yes.
like once in 5 years or
No, no,
anything.
no. It is very important. It can fluctuate very, very easily. And even now, it's not the postmenopausal age group of people who come with heart attacks. Heart
Mm-hmm.
disease can present just as early as 30, 40. Women,
Mm-hmm.
you don't have to be postmenopausal to have heart disease. It can
Okay.
always present earlier, and it's better to just check. Prevention is always better.
Okay. So are you seeing a difference like from the time you started to now within like the age group that's coming to you?
Yes, when I joined, the ICU used to be full of 50-year-olds, 60-year-olds, and just above 50 in general. But
Mm-hmm.
now, every day, the ICU has at least 5 30-year-olds, 40-year-olds. And that's become common now. Now, I don't even feel like it's something abnormal that initially, when I started, if there was a 30-year-old, the
Mm-hmm.
entire hospital would be like, oh, 30-year-old got a heart attack. But
Okay.
now it's like, yeah, another 30-year-old got a heart attack.
Okay.
Yeah.
Okay, so what can this, okay, so say that now the number has increased for this 30-year-old, right? Like, okay, like so many more 30-year-olds are there. So what can they do to prevent coming into the ICU? Like, is there anything in lifestyle management, eating?
Yes, absolutely. Their jobs are more sedentary these days, and their food habits are mostly processed food,
Mm-hmm.
and they are not very active. Some are, not all,
Okay.
but these are all modifiable risk factors.
Mm-hmm.
Genetics is not something you can change, it's already loaded the gun.
Okay.
But lifestyle and habits, daily habits, moving, walking, your food habits, all of this plays a very, very important role, and it's all in your hand. And by lifestyle, I don't mean just smoking and drinking, I mean food, activity,
Mm-hmm.
all these day to day things.
So, metabolic health of a person, do you think that's very related to cardiac health?
Yes, it is. It's very,
Mm-hmm.
very related. It's poor sleep patterns, poor
Mm-hmm.
nutrition, all of this leads to inflammation building up. It keeps the cortisol and adrenaline levels in the body very
Mm-hmm.
high for a long period of time. Your heart never gets to reset.
Okay.
For example, when you sleep, your basal heart rate itself comes down. It
Mm-hmm.
comes below normal.
Okay.
And that recovery doesn't happen when you're constantly scrolling till 2 a.m. and then you wake up at 9 and then go at full speed at the day ahead. So your
Right.
heart doesn't get time to recover, which is very, very important.
So we do know that scrolling increases cortisol in general, right?
Yes, yes,
So should we have like, like a time that, like, okay, like 2 hours before sleep or something like that, like stop
yes,
scrolling so that you
yes,
don't increase that before you sleep so that your heart can rest well?
yes,
Yeah?
absolutely. It gives an emotional, I mean, sorry, uh, what do you say?
Reset.
Information overload.
Oh,
I think that
yeah.
also adds on to stress.
Information overload.
Yes, you're constantly scrolling, you're constantly seeing something. It all affects your brain is non-stop. You're
Mm-hmm.
awake 24/7. Your heart is also running 24/7.
Mm-hmm.
It's basically like your heart is constantly on survival mode, and it's just very difficult to treat when inflammation has built up over years.
Okay. So if inflammation is causing like, like a higher percentage of heart attacks, that means we would say that emotional burnout and all of that like is a
Yes, it
leading factor
plays.
to it as well?
Yes, it plays a very, very, very big role. In fact, there is a condition called Takotsubo cardiomyopathy. It's also called as broken heart syndrome, where
Mm-hmm.
excessive stress, for example, losing someone you love or the
Okay.
death of a dear one,
Mm-hmm.
something that serious, can actually mimic a heart attack. They can have symptoms, they can have chest pain, ECG, echo. All your tests will show that the person is having a heart attack, and it actually damages your heart.
Okay.
It plays a very big role.
Okay, say this person who's gone through this broken heart syndrome because they've like gone through something extremely deep and like very, like lost. So at that time, what can they do to get
They
back?
will have
Mm-hmm.
every symptom, and even on paper every sign will show a heart attack, so they
Mm-hmm.
come presenting as a heart attack.
Uh-huh.
When you see that ECG, you're going to think, oh, okay, she's having a heart attack.
Mm-hmm.
You treat the person just like a heart attack. That person is going to be on medication for the rest of their life to prevent another heart attack, and it's going to take months for her LV function to just improve and come back to normal. It is that serious.
Yeah, like emotional regulation is so
Yes,
important then.
yes,
So like a few hours, to like switch off the phone like before
yes,
you sleep, and then after
yes.
that like do like emotional regulation practices
Yes,
as
like
well.
yoga, meditation,
Yeah.
anything that calms you down.
Mm-hmm.
For example, if you're having an anxiety attack before an
Mm-hmm.
interview or an exam, and
Uh-huh.
you pull that person aside and just ask them to take deep breaths, you immediately see the heart rate, the BP, everything comes down within a couple of seconds, right?
Yes.
Do that. Learn the art of pausing. It's very,
Yeah.
very simple, but it's very effective.
What do you think women these days need to know in general, like for like the entire like day cycle? Like the entire day from the time they wake up till the time they sleep, like what they're going through, right? Like since they don't seem to take a break much for themselves because they don't think
Yes,
they're very important. Like
maybe.
yeah, they're like okay, like first what is it, family, okay, we are born, we studied, and then after that we got married, and then after that children,
Children.
and then they don't take time for themselves
Yes,
much. How do
yes.
you think this plays in heart health?
I think they brush off symptoms so easily. If, for example, if your child cuts his hand or he falls down while he's playing,
Hmm.
you immediately rush. You take him to the doctor, you make such a big scene of nothing. It'll be just a small bruise,
Yeah.
but you react in such a big way.
Uh-huh.
But when you bruise your hand on a stove, maybe a burn,
Mm-hmm.
do you go to the doctor? Oh, it's nothing. It's absolutely nothing. You run it on cold water and you know
Mm-hmm.
it's nothing and you don't do anything about it.
Yeah.
And the same thing, they know what they're eating, they know what
Mm-hmm.
they're cooking, they
Mm-hmm.
know what they're doing, they know that they're ordering every day or they're inactive. All of this they know.
Mm-hmm. Mm-hmm.
And so when they have a mild chest discomfort, immediately they term it as it's gastritis. I ate this morning.
So that's what the majority of your patients come
Yes,
with. They're like,
yes,
okay, I ate this in the
yes.
morning, but then now, like
Yes, and it's
shortness of
very
breath.
difficult to convince them that no, no, it's not indigestion, it's a heart attack. And no,
Okay.
they'll be like, no, no, it's just I ate this in the morning and that's why I'm feeling this way. Just give me that gas tablet and I'll go home. It's not, it's really not. And I have to
Yeah.
prove it to them that it's not.
Okay. Okay. Is there a difference? Like you were saying that now 20 and 30-year-olds are coming as well,
Yes, yes.
like women with heart attack?
Women 30, 40, 40 year olds, yes,
Uh-huh.
definitely, yes.
So is
But
that perimenopause?
I think estrogen levels start falling
I see.
earlier. Yeah.
Okay.
And estrogen is actually a protective hormone. It maintains
Mm-hmm.
the tone of the blood vessel and keeps your cholesterol levels balanced.
Okay.
And once that starts falling, cholesterol level rises, blood pressure rises, which are all risk factors for a heart attack or any cardiac disease.
Okay.
So that is why it's not just postmenopausal. Anybody who is having a very stressful lifestyle
Mm-hmm.
can just as well have.
Like a heart attack.
Yes.
Okay. Do you think, how about like wearables and like AI and all of
Oh,
that? What is the
yes.
role of that in like today's health for women?
It's very interesting, right?
Mm.
That people get to track their heart rate and
Mm-hmm.
blood pressure and their activity in real time. It's
Mm-hmm.
very useful. But when you see patients, they often worry about it and come. And I
Okay.
think it shouldn't be something that makes you worry about your health,
Mm-hmm.
but instead go back, learn, read patterns. AI, especially, it reads subtle changes very early.
Okay.
So go back on that data, connect with your body. Don't just use
Mm-hmm.
it to worry about yourself like I didn't
Uh-huh.
do 300 steps and
Mm-hmm.
don't do that. But if you haven't slept properly over a period of a week,
Mm-hmm.
then do something about it. go back and check that data. It's not just 1 day, 2 days, it's so many days. You can always
Yeah.
go back and check.
And
So
track
connect
and
with
see
your body.
why, like,
Yes.
sudden changes have
Yes.
happened or something like that.
Yes, it's not about, oh, okay, today let me check my heart rate. Ah, this was fun, it's normal. No, it's not that. Go
Yeah.
back on that data and check if there is variations. When your heart is racing, when it's calm, give yourself more calm.
Okay.
Yeah.
Yeah. You have actually, I think you told me that after you met, like, so many patients coming with stress, you actually thought that you should start something by yourself to actually help them,
Yes.
right? And that is
Yes.
how parties therapy came about.
Yes,
Could
that
you
is
tell
how
us
parties
more?
came to
Yeah.
being.
About it. Huh?
Yes, that was most of the patients who are coming these days don't have any history of diabetes or hypertension or family history or smoking.
Right.
They don't have any big risk factors. And the only thing I could relate why could they possibly be having a heart attack was stress. So
I
I
see.
wanted to do something that could calm people down. And so I started a brand which helps people sleep well, calm them down, just get you to pause somewhere during the day. Yes.
Yeah.
So that's the soul of that.
Yeah, so that when they use party therapy, they take that 15 minutes to just relax
Yes.
before sleeping.
Yes. And they
Yeah.
sleep better also.
Yeah, yeah, because I've used it as well. And it
Yes.
was like, oh, yes, very peaceful sleep. Yeah, yeah, it was very nice. Okay. So, what you're saying is, even like, as like 30 and 40s, we shouldn't just be like, okay, okay, this is for like an older person. Like,
No.
the people who get it are older, not as fit, not as this thing.
Yes.
But it also happens to people who like look like us and,
Yes. 30-year-olds,
yeah, yeah,
40-year-olds, it's
they're
just
coming.
as possible.
Yeah.
Yes.
Okay. And but what is it? We're saying that emotional trauma and all of that like causes it too, right? So is it just physiological or is it psychological as well these days?
It can be psychological also. Not really sure, but both. It's definitely both. It's not all physical and it's not all psychological. Psychologically, if you're having a heart attack, it's just acting like you're having an heart attack, right? So,
True.
yes, everybody's like, oh, I've seen a lot of older women have some problems at home and they'll want some attention basically. So they'll come
Uh-huh.
with chest pain.
Okay.
They'll have all
Yeah.
normal ECG. I'll do all the tests. If you come pretending to have a heart attack and take away that time from a patient who actually needs care, then
Uh-huh.
I'm going to do all the tests and make sure you don't have a heart attack.
Yeah,
But
yeah, yeah.
some people do that just to get
Yeah.
attention from family.
Yeah, when it's not there. Have you seen like like the people who are coming, right? Like you'll have some kind of history, like you'll be able to notice like, like okay, how the family is or like how they are. Are they usually emotionally disconnected or how is it? The younger ones who are coming, or do they seem like they have more anxiety in their lives? How is it?
They do have a lot of
Hmm.
anxiety in their lives and they're always worried. Even at
Yeah.
discharge, they're worried. And I feel like once they have a heart attack, they're even more worried because,
I-
they're
Is
like,
it is it
yes,
like financial anxiety or
maybe.
is it like, I mean, because I did think about it once, like earlier, like the previous generation, right? They had financial anxiety, like for sure. But when they had it, they were getting the heart attacks at like 50, like late
Yes.
40s, 50,
Yes.
60. Now that we have more awareness, I feel like health anxiety is going on one side and financial anxiety is going on the other side. Do
Yes.
you
And
think
they're all
it's.
pressurized to do more, to achieve more, to.
Mm-hmm.
There's a lot of pressure. So, yes, absolutely. Stress plays a
Yeah,
big, big role. They're all stressed out. Everybody is stressed.
really?
Yes.
Like
Whether they're
everywhere?
studying, even
Yeah.
students, they're so stressed. Whether they're working, they want to climb higher, they have loans, they have so many problems, but everybody is same stressed.
Seems stressed.
Stressed, yes.
Yeah.
Yes. And once they have a heart attack and I actually talk to them, they're even more stressed that their heart is also gone. So,
Oh.
so I always cheer them up saying, no, no, your heart is okay. Now
Yeah,
it's
yeah,
okay.
yeah,
So,
yeah. Like, take care. And do you, okay. So now, after they've come to you with a heart attack, right? Like, what do you say their aftercare should be? Like, do they, like, is the survival rate like good? Like, after they come the first time, they take care, they take all the like post MI medicines and all of that, they're fine? Or are there like cases where you see, like, okay, they're like really anxious about it and then they keep coming again and again? How is it?
there are people who are very anxious,
Mm-hmm.
especially younger people like 27, 28, and 30-year-olds, 35.
Mm-hmm.
They're more anxious.
Okay.
They panic because they're only 35, they've already had their first heart attack. A
Okay.
lot of people don't make it beyond the first heart attack. So
Yeah.
imagine they survive till 50 or 60 and they're always
Mm-hmm.
going to be worried what if the next one comes? I may not make it.
Yeah. Like
Yes.
after they get the first one, especially if they get it at that younger, the 35, mid
Yes.
40 age,
The
right?
rest of the life, they're mostly panicking.
They're like, okay, are we going to get it again? Like,
Yes.
So
They
what
need
would you tell a
extra.
person who gets the heart attack at a younger age? How would you advise them to go about the next few years without getting scared?
I will always give them reassurance.
Mm-hmm.
There should be hope, definitely. Make the
Uh-huh.
most of whatever lies ahead,
Uh-huh.
but don't spend it panicking about what happened.
Uh-huh. So kind of like,
So,
okay, life has
and
given you a
once they
second
have the
chance.
first heart attack, I
Uh-huh.
think they always change. They
Yeah.
don't really care much, but
Okay.
they're worried that something will happen to them, so they immediately try to settle finances. They get everything
Okay.
sorted. The children
Yeah, yeah.
shouldn't be worried. Their
Yeah.
parents should be taken
Mm-hmm.
care of. All of that is done,
Uh-huh.
but they they need a little extra
Yeah, like
reassurance.
reassurance to be like, yeah, everything is fine. Yeah, because it's like a huge life event, right?
Yes.
Yeah, that's true. Okay, so what new innovations in like cardiac like science is exciting you these days?
Oh, I like anything that I like anything that eliminates the need for open heart. And I'm sorry if that offends surgeons, but
Uh-huh.
I do like minimally invasive procedures and interventions that don't really have to open up the chest and is
Yeah,
too
because it takes three
taxing on.
months to recover, right?
Yes. So
Mm.
minimally invasive anything like CTOs and complex
Mhm.
interventional procedures and rotabulation, all of this really interests me.
Yeah,
While
and it's
modern cardiology is about precision, recently I read this paper where they're talking about how genetics and metabolism can help you personalize treatment for each patient.
that's
I
so
found that,
amazing.
yes, I found
Yeah,
that very, very interesting. I think that's the future.
yeah,
Yes.
personalization for health, right?
Yes.
Like
And
how Brian Jones, the person who speaks about like longevity and wellness is like everything right now, right?
yes.
Okay, so what is your thought about like cryotherapy and like heat, like the warm baths? Cryotherapy is going inside that freezing water,
I really don't know
you
much
know.
about it.
Like they say that it's supposed to like improve heart health, and then now there's like an argument that what is it? Cryotherapy is not that great for women, but it's great for men for like recovery, like post workout and everything.
Yeah.
What do you feel about that?
I don't really know much about it, but I think it
Mm.
also acts on the same terms. It
Uh-huh.
stimulates the parasympathetic nervous system, and then that helps you calm down, keeps the heart rate normal, blood pressure normal.
Mm-hmm.
Basically, that's
Yeah.
the science behind all of this, including
Yeah.
yoga, cold baths, all of
Mm-hmm.
it. It's
Okay.
definitely good.
So is cholesterol still the main villain?
No. No.
Then who is the
The
main
main
villain?
villain is you. You don't
Yeah.
take care of yourselves. You'll just,
Yeah. So
nobody takes care
actually,
of themselves.
okay. So if you had to name like 5 points as to what a person has to do so that they don't come and see you when they're younger, they can come and see you later in life, but
They can
not
always come see me.
when they are
But
below 50.
I think they should
Uh-huh.
change their food habits.
Okay.
Definitely, that's a non negotiable.
Mm-hmm.
Food, processed food, like focus on whole foods, snack on fruits instead of
Snacks.
eating out. Yes.
Yeah. Mm.
And move for at least 30 minutes a day.
Okay.
Whatever it is, whatever you enjoy doing, but move every day with some consistency and intention.
Mm-hmm.
Don't have a sedentary lifestyle. Sleep properly. Learn to manage stress well.
Okay. So what does learn to manage stress well mean?
I'm also still learning, so I can't really answer that
Okay, so we
question.
can say you can do meditation every day for
Yes,
like
like
15
take a
minutes yoga.
pause,
Yeah.
just breathe. Don't
Yeah.
stress about everything. Not everything is a big problem.
Mm.
Don't
And
give
that is
yourself
true.
bigger problems worrying about the small ones.
Yeah. Actually, I read a very interesting story the other day. A young man who was 27 years old presented with a stroke, right? And he had no other factors, like he didn't have high BP, he didn't have
Hmm.
diabetes, nothing. And he's young, he's 27, and he didn't drink, he didn't smoke. Then how did he get a blood clot? Right.
Hmm.
So then they were checking his entire, like, like lifestyle. What does he do after he wakes up, and you know, what is his activity schedule,
Hmm.
right? So what they noticed was everything was fine. The thing was, in the evening when he got back home, he didn't socialize much. That is one. So maybe like that loneliness factor. And the other factor was he always used to overthink about how things are going on. So overthinking is actually a problem.
Yes.
Though it is fun to overthink. It is
Yes.
like, oh, that person said this to me the other day. How could she say it in that tone? I am this person, they are that person. It can go, and it's so much fun, right? Because it gives
Yes.
you that like adrenaline rush for a while. Like, wow, wow. And then the thing is, after the first time you think about it, that time you get an adrenaline rush. Then the second time you get that rush, it's not as much. So you have to think more to get that adrenaline
Yes.
rush, right? So the loop thinking that goes there, what is it, causes such issues, is what they said.
It could be stress.
Yeah.
And builds up inflammation.
Yeah, so it builds up inflammation. Like even if you have like really good like lifestyle habits otherwise, okay, you're going to the gym, okay, fine, you're doing this, you're doing that. But at the end of the day, if you are not, like taking care of your mind, your
Yes.
body still doesn't follow suit.
Yes.
Like the mind is also very important.
Very true.
Yeah.
Yes.
Yeah. Okay. So do you listen to your own advice on balancing stress and work life as a practicing cardiologist?
I am learning to listen to my advice. I'm getting better at it. My sleep schedule is absolute chaos for
Yeah.
starters.
Yeah, yeah.
But I'm
Because
better at it. I think, like how they say, never trust a thin cook. How do I expect my patients to trust me if I'm not healthy? So I make it a
that's
point
true.
to start. I've started taking care of myself.
Yeah. No, that's
Yes.
amazing. Exactly. Because I feel like that's where it starts, right?
Yes, that's
Only
where
when
it
you
was.
start with yourself, the
Yes.
people that you're saying it to will actually
Yes.
resonate.
Yeah, that is true.
So, what's a heart myth that you wish people would start believing? Stop believing.
That heart diseases are a man's problem. No, it is not. It is just as much a woman's problem.
Okay.
That is something I really wish more people understood.
Yeah, because I feel like even when we had to learn like statistics, even like, we have that stats class, right? It was like 89% of people with heart attack in the hospital are men. But there's so many undocumented cases of women
Yes.
because they never complain about anything.
Yes. And
Yeah.
men are usually outside also. It could be a tiny factor, but they're
Mhm.
usually outside when they're having a heart attack. They're either at work or they're playing something or they're out.
Mhm.
People
Okay.
they present well.
Mhm.
Women, they are at home, they don't really make a big fuss of it. They think that it's nothing, and then they come very late or they don't come at all. They come very very late at a point where you can't really do anything to,
Right. To like
yeah,
actually help,
help.
right? Okay. So the other thing is, I remember, like, back in the day when I was doing my internship, there was this marathon runner who had bent down to tie his shoelace and he fell off. Right. And at that point of time, it was shocking because it was like, oh my God, he's so active, healthy. What is this? And he was already gone by that time because, they brought him in quite late because nobody expected it to be a heart attack
Yes.
or anything of that sort because he's young. He was like 20s and like
Mm-hmm.
active. So many people have been saying that recently. They were like, okay, this guy is like a runner, he's an athlete. Like, why is this person coming? Why is that person coming? What is your view on this?
My view on it is anybody can have a heart attack. I see 20-year-old, 25-year-olds having heart attacks. It's very very possible whether you're fit or you're not.
Hmm.
But you got to do your part in preventing it, is
Hmm.
my opinion, is my advice. You do what you can to prevent a heart attack. The chances of you having a heart attack if you're fit is a little lesser than a person who's having a sedentary lifestyle, is not moving at all. So, obviously, I will advise you to be active, to do go
Hmm.
work out, yoga, something, but be active. But that does not minimize the risk. And there are a lot of other factors, genetics, cholesterol, all of that also plays a role. And like you said this in your story, the person was 20-year-old.
Hmm.
Yeah, it's
Yeah.
very difficult to convince people that a young person is having a heart
Yeah.
attack. It's and it's always too late, but for me at least it's very difficult when I tell them your son is having a heart attack. They're like, no, 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 he's young, he's fit, he doesn't have any other risk factors. I am 60 years old, I never had a heart problem.
Hmm.
There's no genetic. It's very very difficult to convince them itself that they are having a heart, their son is having a heart attack, he needs treatment. And so the care just keeps delaying. In
Right.
cardiology, the first 20 minutes of having a
Yeah.
chest pain is
Yeah.
very very crucial.
Hmm.
So the podcast that you're doing is very, very good, because people now are should be aware that it can happen to anyone. So don't delay treatment just because of disbelief. It is very, very possible that a young, fit, no other risk factor person can have a heart attack.
Right.
Yes.
And the other thing that we've noticed as well is post COVID, everyone, like doctors that I've been speaking to, we love the vaccine. We love that we got the COVID vaccine, right? Because it helped us. Otherwise, we won't be able to be sitting here and talking and
Yes.
stuff, right? It helped us a lot. Nobody is like, putting, like, minimizing that. But they have said that the number of heart attack cases have significantly gone up after.
Yes, it is true. A lot of patients come with ectasia, not necessarily stenosis or an occluded artery, but the troponin in the blood value shows that the patient is having a heart attack.
Okay.
Basically, meaning your heart is not getting enough blood.
Mm.
Due to it could be due to various reasons. Patients who've had COVID before or have taken any COVID vaccine have more chances of ectasia. Initially, that used to be the case for smokers. Now it's for people who've had COVID, taken the vaccine.
Okay, so that's like that post-viral inflammation like going
Maybe
on
there's
in the
not
body.
enough data to back it up because it's just now being observed. But this is purely based on the patients that we are
That
seeing
you've
in
been
our
seeing?
hospital. Yes.
Yeah. Very interesting. For like, like just the landscape of like cardiology
Yes.
itself is changing, right? In the
Yes.
past like 5 years itself, I think there would have been so much change because like with
Yes.
COVID right in the center.
Lifespan itself is falling.
Yeah. Oh, I always keep telling everybody, oh, we're going to live till 100, 120.
That's
So
the
we better be fit.
optimism.
No.
Initially,
falling.
most people who are dying, or
Yeah.
if you take the mortality
Yeah,
book,
yeah.
it'll be 70 plus.
Uh-huh.
Now it's 30, 40, 50.
Right. So that's the other thing. So the other percentage that I saw was like people who came with heart attack was like 10% below 50. But you agree with me? You disagree with me? Below 50?
Little more than, yeah, definitely not 50-50, but definitely 30-40% of the patients are in that population where I am working. It's definitely more.
Yeah.
I don't know about the rest of the country, but
Yeah. Okay. So take less stress, guys. Okay. So what I would like to leave you with is live with little less stress. I understand, okay, financial stress is really high, emotional stress is high, so many things are going around. You have like parental stress, you have like different like stressors, right? Your parents' health, everything, your like siblings and all of that. What I would like to say is you have this one life. It is your life. You are curating your own life for yourself, right? So you can make a choice about what you want in your life and what you don't. And like, in case there is some particular thing that you've been thinking about for more than 3 days and you're not able to make a change to it, it is going to be that problem even if you think about it for 10 days, 20 days, 30 days, and you're not going to get an immediate solution. I would suggest letting go of it. And if you want like different methods to let go, try meditation for one, or like activity, yoga, and all of that. Because if we don't take care of our own health, nobody is going to come and help us. The healthy food habits that we make, right, like steamed vegetables and like fruits, you can have like your oil fried things once in a while. Nobody is saying no. That is not going to like increase your cholesterol in a day, right? Even if you have it like once in 10 days, once a month, once a week, like you can go to any dietitian, they'll be like, okay, fine, you have your cheat day once in a while, right? That is fine. But your daily basis, like how you are choosing good food to put into your mouth, choose good thoughts to put in your mind as well, good feelings to feel in your heart as well, because you are important. You have one life, so curate it the way you'd like to. Thanks. So, if you're a woman watching this podcast, what I'd love to tell you is please take your health seriously. You matter too. Your husband matters, your children matter, yes, but so do you. And only if you take care of yourself can you take care of them. Because you can't pour from an empty vessel, and you are the vessel that nourishes everybody in the house. If you liked our conversation today and think it might help you or someone that you know, please share the video and like and subscribe for more such content on health. And if you have any questions or queries that you think that we should address, please put them in the comment box. Thank you for watching.